Addison's disease is not a condition that might be as commonly discussed as, say, diabetes or hypertension, but it is equally significant in the world of endocrinology. The ripple effects of Addison's disease is felt throughout the body due to its vast number of symptoms. Historically, it was tied to tuberculosis, but today it's more closely associated with autoimmune diseases. The signs and symptoms can be subtle to severe, but in the end, this is a fascinating disease that is important to understand for any healthcare professional. When we speak about Addison's disease, we're referring to a condition that primarily centers around the adrenal glands, which are situated just above our kidneys. These glands might seem small in size, but their role in our endocrine system is huge. Their primary duty is the production of essential hormones, namely cortisol and aldosterone. Cortisol is often termed the stress hormone because it plays an important role in regulating metabolism, reducing inflammation, and controlling our body's sleep-wake cycle. On the other hand, aldosterone manages the balance of water and salt in our bodies, which has a major influence on blood pressure. The underlying pathogenesis of Addison's disease involves a decline in the production of these hormones by the adrenal cortex. But what do you think that means for our body? Well, for starters, a reduced level of cortisol affects our body's ability to respond to stress, manage blood sugar, and regulate metabolism. Similarly, when aldosterone levels drop, our body struggles to maintain the right balance of salt and water. This imbalance, in turn, can lead to fluctuations in blood pressure. The root cause of this diminished hormone production can vary, but the resultant effect on the body is compromised ability to handle stress, maintain metabolic functions, and regulate blood pressure. As we proceed, we'll discover how these changes manifest themselves in signs and symptoms, and how etiologic factors contribute to the onset of this interesting disease. To truly understand Addison's disease, it's essential to review the forces that bring about its onset. In industrialized nations, the primary cause behind the majority of Addison's disease cases is an autoimmune response. In these instances, the body's own defense mechanism, the immune system, mistakenly identifies the adrenal glands as foreign entities, subsequently attacking and damaging them. As the damage worsens, the adrenal gland's ability to produce cortisol and aldosterone diminishes, resulting in the clinical picture of Addison's disease. Historically, a major cause of adrenal gland damage was tuberculosis. While it might seem unrelated, tuberculosis in its advanced stages can infiltrate the adrenal glands, causing significant destruction. Though the incidence of tuberculosis-induced Addison's disease has lessened with better tuberculosis management, it's important to recognize its historical significance. Of course, other causes can come into play as well. Certain infections like HIV or certain fungal infections can compromise adrenal gland function. Sometimes, sudden events like hemorrhage or clotting within the adrenal glands can cause Addison's disease. Furthermore, metastatic cancer has the potential to spread to and damage the adrenal glands. Situations requiring surgical removal of the adrenal glands will also naturally lead to this condition. Lastly, while less frequent, genetic factors can predispose some individuals to the disease, revealing that familial tendencies may occasionally be at play. A fascinating aspect of Addison's disease is the various symptoms with which it presents. This emphasizes the critical role the adrenal hormones play in various functions of the body. Initially, many of the symptoms can be insidious, slowly infiltrating an individual's daily life. One of the most pronounced and universal symptoms is fatigue. Individuals often describe an overwhelming sense of tiredness, paired with muscle weakness that doesn't align with their usual daily activities. A rather unique characteristic of Addison's disease is darkening of the skin, which is termed hyperpigmentation. This can present itself in patches or more generalized areas and is especially notable in areas of the body that receive frequent friction, like the knuckles, palms of the hands, or inside of your cheek. It looks like an uneven tan, but has its origin in the hormonal imbalances of the disease. Speaking of these imbalances, the decreased aldosterone levels often lead to lowered blood pressure. This can present as dizziness or even fainting upon standing up, a condition we call orthostatic hypotension. Some people with Addison's disease might find themselves with an intense craving for salt, which is a direct response to the body's reduced sodium levels due to aldosterone's decline. Addison's disease can also cause severe problems with the gastrointestinal system as well. Patients frequently experience bouts of nausea, abdominal pain, and altering episodes of diarrhea or constipation. It's not merely a physical toll. The mind feels the strain too. Symptoms such as depression, irritability, and heightened difficulty in concentrating are not uncommon. As with many medical conditions, when Addison's disease goes unmanaged or unrecognized, it can give rise to severe complications. Perhaps the most alarming and acute complication is the Addisonian crisis, also known as acute adrenal failure. This crisis represents a medical emergency and demands immediate medical intervention. Patients might experience severe pain that can be localized to the lower back, abdomen, or legs. Pronounced gastrointestinal symptoms can accompany with severe vomiting and diarrhea, which can lead to significant dehydration. These combination of factors can cause severely low blood pressure, pushing the body into a state of shock. Ultimately, the swift recognition and treatment of an Addisonian crisis can mean the difference between life and death. However, not all complications of Addison's disease are acute in nature. Many patients struggle with lingering chronic issues, even with proper treatment. Persistent fatigue and muscle weakness can hinder day-to-day activities and affect overall quality of life. A consistent dull ache or pain in the joints and muscles can also become a recurring theme. With the alterations in the immune system's function due to cortisol imbalances, there is also an increased risk of infections. This requires patients to be proactive in safeguarding their health. Managing Addison's disease brings about its own set of challenges. Patients often will require lifelong hormone replacement therapy to simulate the hormones their adrenal glands no longer produce in sufficient amounts. Regular monitoring also becomes very important to make sure that hormone levels remain normal and don't go too high or too low. In addition, patients must be adept at recognizing and managing stress, as heightened stress can aggravate symptoms and, in extreme cases, provoke an Addisonian crisis. And with that said, thanks for watching.